Yes.
I also carried out after that a mental state examination.
Let's allow interpretation.
Agamba alipoota ye yagiwandiika nga 3 mwezi gw'ekumi n'ebiri 2025 ng'ate omulwadde we bali bamuyita Christopher OKELLO Onyom. N'agamba nti omulwadde we yali alina emyaka 38 egy'obukulu nga musajja nga yali abeera Bbunga, nti ebyo omwami Christopher ye yabimugamba era n'amugamba nti yali tali mufumbo nga mugoberezi wa Kristo, ng'ate akaseera ako yali ayagala kutandika kubeera mu Uganda nga akola bizinesi y'obulimi oba okulunda, nti era okusinziira nti yali asabye okukola ripooti okulaba nti omutwe gwe gwali guteredde oba gukola bulungi, yagezaako okwogeramu naye alabe omutwe gwe oba gwali gukola bulungi oba nedda, oluvannyuma n'amukebera okulaba oba obwongo bwe bwali bukola bulungi oba nedda.
Doctor, what does this psychiatric examination entail?
My Lord, a psychiatric interview entails asking the client many times open-ended questions. The interview the interview entails asking various psychiatric questions, with the aim of...
Doctor, I heard that it entails asking the client many times open-ended questions. That's where I stopped.
Yes, psychiatric questions with the aim of trying to enlist if this client has any mental disorder.
So in this case, what did you do?
My Lord, upon asking him those questions, Mr. Yuri told me the following. Mr. Yuri told me that he has no history of having excessive sadness. He has no history.
Go through, doctor, as I advised.
Doctor, is that all that on your report or?
Yes, my Lord.
Okay.
Should I continue, my Lord, with the same? Okay.
Yes.
Yeah.
No history of excessive sadness.
He had no history of loss of interest in pleasurable activities.
Sorry, kindly repeat that. He had no history of having excessive sadness.
Yes, my lord. He had no history of loss of interest in pleasurable activities.
Yes.
My lord, he also had no history of excessive fears or excessive worries. He had no history of worries, yes.
I shall be prompting you.
Okay.
No history of excessive fears,
Or worries.
worries.
Yes.
Yes.
He had no history of excessive happiness or increase in goal-directed activities.
Increase
In goal.
Okay. If I may pause a little there.
For interpretation first.
nti okumukebera obwongo nti bamubuuza ebibuuzo bingi nti ebimu bamubuuza okulaba nti oba omutwe gwe gukola bulungi oba nedda nti mu musango guno ng'amaze okumubuuza ebibuuzo ebyo bye bababuuza yamugamba bino yamugamba nti yali tafunangako okunyiiga okusukkiridde era nti teyafunangako okubeerawo nga takyayagala kwetaba mu bintu ebyessanyu nti era yali talina okubeerawo ng'awulira atidde nnyo nnyo oba yeeraliikiridde nnyo nti era teyalina ekiraga nti yali asanyuka nnyo 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 oba okubeerawo ng'ayagala kukola ebintu ebisukkiridde.
Doctor, why were these questions important in your professional assessment of your client?
My lord, these questions help us to establish various mental disorders, if any, in any client that comes before us.
Okay.
Continue. My lord, let's
just a minute. How do they help you? The court would want to know why, for example, you focus on excessive sadness or interest in pleasurable activities or excessive fears and worries or excessive happiness or excessive goal-oriented activities. Why is this particular direction important to you as a profession in determining or detecting mental disorders?
My lord, these questions are key to the various mental disorders. For example,
Mental disorders. Yes.
when I ask a client if you had history of excessive sadness or loss of interest in pleasurable activities,
Yes.
I'm trying to elicit if you have depression. If I ask about fears, excessive fears, or excessive worries, I'm trying to elicit if you have an anxiety disorder.
Yes.
The question I asked about excessive happiness or increase in goal-directed activities, I am trying to elicit if the client has bipolar affective disorder.
Has
Okay.
what? Sorry?
Has bipolar affective disorder.
Affective.
Affective disorder.
Okay. So other than that, what else did he reveal to you? Or did you ask him?
My Lord, he also told me that he has no use of hearing voices, or seeing things other people could not see.